Visual field defects. So here we are looking at the various types. It includes the isopter contraction. Then it also includes the pairing of blind spot. Next, there is the relative paracentral scotoma. So this, if you see, it is the earliest clinically significant. It is the earliest clinically significant. Okay. Next, we look at the other visual defect would be the sedal scotoma. Then there is the arcuate scotoma. Then comes the Bedram's scotoma. Then there is also the double arcuate, or it is also known as a ring scotoma. And what it does, it depicts the Royni central nasal step. Then what we see is there is the tubular vision and as well as something known as a temporal island of vision. So then there is the temporal island vision. Next comes the loss of perception of light. So just to represent the loss of perception of light, it encloses everything. Whereas in case of the temporal island vision, it almost covers everything except a slight crescent shape is left out. So this portion is left. Next, if we see the tubular vision with temporal island, so here it almost covers everything and the center is left, as well as a slight area of the crescent is left. So these areas are left out. Next, the diagrams we missed out, that is the relative paracentral scotoma. So in case of bearing of blind spot, this is how the image looks. And in case of relative paracentral scotoma, this is relative paracentral scotoma. Next comes the sedal scotoma. In case of sedal, this is sedal scotoma. Then looking at the arcuate scotoma. In arcuate scotoma, it is also known as the Bedram's scotoma. So here, this is how it looks. Then looking at double arcuate. In double arcuate, it is the same thing. And next, we already saw there is a tubular visions and the loss of perception of light.